Ordering blood tests in Vision. So this is all done via the ICE system. Don't know what ICE stands for, but that's just what it's called. And it's this little button here. You click that and then you log in here. If you don't have a login, you can just create one. Usually you just use your GMC number for both the username and the passwords. Save these details for my own personal use and then click OK, and then it should work for you perfectly henceforth. And so when you do that, yeah, it gives you the option of all the blood tests that you can order. You've got common tests there, which is the one that that displays immediately. But then you've got all of your more fancy ones, all of your specialist tests that you can choose as well. Most of the time you're just using these ones. So for example, I don't know, a patient with fatigue, you might want to select FBC, HbA1c, and use and ease, or whatever, and TFTs maybe. You can also search. Sometimes you can't find fancy ones, so I can never find CCP, for example, so you can just search for that there and it comes up. And then once you've selected all of the blood tests that you want to do, you just simply click continue with request. Then you put in the clinical details, so I don't know, tired all the time. Make sure that it's you selected, which it should do automatically. And then if you're going to take them there and then yourself, then all you need to do is click on accept request, and the labels will print out, hopefully, from your label printer. Usually though, as a clinician, you want the phlebotomist to be doing it because you're too busy to be doing the blood tests as you go. So what you then want to do is click print labels later on each of these. It helpfully tells you which blood tubes you need for them as well. But anyway, if you're not doing them, you click on print labels later, like that, and then you click accept request. And so as you can see now, the labels do not print off, but it gives like a little ticket here. It documents that you've requested them and which ones that you want the phlebotomist to take. So then you do that, then you'd send the patient away to the front desk and they would book in with the phlebotomist and they would have these done. The phlebotomist, I mean, you don't really need to know this, but the phlebotomist will then open the patient's notes. They will click on, they will log in with this, and then they go to patient request list, and then here you can see all of the requests. The ones that are missing, the ones that have dates here, those are the ones that have been taken. The ones that are missing sample collection date are the ones that are pending. And so the phlebotomist will just click on that and then click on sample now, and that will print the label. If it's just one test, then that one blood tube, that's fine. It's quite onerous though doing it if there are multiple ones. So better way if you're doing multiple is to actually just click edit request, and that takes you back into the ICE ordering system. And then you just go continue with request, untick these, and then click accept request, and it'll print them all out. It's quite a useful way for if you've forgotten, if you do your request and then you think, damn, I forgot this blood test. That's how you do it. You edit, you go in the way I've just shown you, and then you edit your request, because in that screen you can add more tests or get rid of tests, and then go continue with request. This button is if you've forgotten something, so you can go back to more tests, and then if you still want the then you can take them yourself or ask the phlebotomist to take them. This is for these ones so if you're doing them now, you just leave that and click accept request. If you are leaving, swabs, for example, at the front desk for patients to collect to do at a future date, then you really should tick this, because oh no, that's nonsense. No, sorry, that is not correct. Sorry, it's the patient to collect one. Don't know why that one doesn't have it for hematology. Yeah, it's patient to collect, and that means that the patient then it will leave the date taken blank. So the patient will then have to write on the date that they did their urine sample or swab test or whatever, because otherwise it'll confuse the lab. Because otherwise, let's say you print it out and leave it at the front desk, the patient does that in a week's time. The lab, when they get it, they will have the date on it from being a week ago, and so they will either just discard it or they'll phone the practice and ask for more information, which is a waste of time. So that is ICE.